right, we're live. Oh yay, we're live. Yay.
Yay!
Happy Tuesday, right? Even though it feels like a
Tuesday.
Friday, but a little bit. But hi everyone, Dr. Levinton here. I help people live long and well because I believe the quality of life is just as important as the quantity of life. I know I say this every time I come up. I am excited again to be doing this live with you because this topic is very practical, very relatable. A lot of people have expressed their excitement at the topic. We're talking about effective stretching techniques to help limit neck and back pain. Before I introduce my guest who's already here, I want you, if you know someone who should watch this video, if you do us a favor, just simply forward this link to them or forward the stream so they can watch it live. We will be taking questions, throughout the show, so feel free. And if you're watching live, so I know you're here and I can give you a little hoo hoo woot woot oh, yay. Just hashtag live. And if you watch a replay, hashtag replay. Okay. Now that being said, how many of you have had, back neck pain and, you've almost normalized it? Well, I'm happy to let you know because we're sitting down a lot, we're working from home, that you don't have to, it's possible to live a life where back pain and neck pain is not something that is normal for you. Okay. So I am excited to have on our guest, Dr. Sara Ionescu. Did I pronounce that right?
Yeah, Ionescu, that's perfect.
I did. Yeah, yeah. Okay. All right, Doc. Thank you so much for coming. Thank you for taking the time to hang out with us this evening. If you don't mind, if you kindly introduce yourself again, who you are and what you do.
Sure. So I am Dr. Sara Ionescu. I am a board certified family medicine physician. I'm a wife, a mom of four, and an exercise enthusiast. So yeah, I'm family medicine, take care of, babies to elderly, the whole situation. And, I got into that actually because in med school, when I was a third year student, I liked all the rotations. Like I found things from each rotation that I really enjoyed. And then I thought, oh my gosh, how am I going to figure this out? I like all these things. And then when I got to my very last rotation, which was family medicine, it was like, oh, I can do a lot of the stuff from all the other rotations. And it was actually the first rotation where I felt so comfortable. I just belonged there. Like instantly, the feeling was of belonging. And that was how I chose to do family medicine.
Yay. Love family medicine. Now, why the exercise? I mean, it may almost sound, intuitive, but why exercise? What made you fall in love with exercise? Because it doesn't sound.
So, yeah, I think for me, I was inspired to start doing exercise posts on social media because for me, for a long time, I struggled with figuring out how to do it. And so I was an athlete growing up where exercising was just part of the everyday. It was built into my everyday life because I was on teams basically from like age 5 through college. And
Wow.
then when I became an adult, and it wasn't part of my everyday anymore, I really struggled with how to do it. Like I couldn't figure out how to fit it in. I couldn't figure out what to do. And then when I went to med school and got married and started having babies, it was just like, what am I doing? Like I couldn't figure it out, which was frustrating to me as a physician because I wanted to be healthy. I wanted to be a great model, for my family and all of that. And so I started slowly but surely working on things and figured out a lot of tips and tricks and things that worked for me to get me consistent with exercise. And actually, in thinking about it, like the more kids I had, the more consistent I became, which almost felt counterintuitive because it was like, I should have less time, but I'm actually exercising more. And then when I kind of started talking to people about it in my life, they were like, how are you doing all of this? And when I sat down to think about it, it was like, okay, maybe this, like what I have to share would be helpful for others that want to exercise and have that drive, but are just finding it challenging to figure it out. And so some of the stuff that I figured out, I thought, well, I'm sure this might be helpful for other people. And so that's, I'm so passionate about preventative care and health and wellness and the not only physical but mental benefits of exercise. I think that kind of all of that wrapped up is how I got really excited about exercise.
I love it. Exercise is medicine. I love it.
Yes.
It's very good
Yes.
medicine. All right, so let's delve into it. So outside of injuries, because that's a common cause of neck and back pain, but what would you say are the most common causes of neck and back pain?
So I think really it's musculoskeletal issues. I think a lot of it has to do, like you already alluded to, I think a lot of it has to do with posture and the fact that many people have jobs or lifestyles where they do have to do a lot of sitting. And if
Mm,
you're not sitting in a way that's, ergonomic for your body, then it can lead to being in positions that are not great for your body. And then you end up having pain because of that long-term situation. So I think really the most common thing is musculoskeletal. Another thing that I saw a lot with my patients is old pillows, especially for neck pain. People would
mm.
come in with neck stiffness, and I would like the first question I started asking is, when's the last time you changed your pillow? And it was sort of like, oh, it's been a long time. And then they would come back a few weeks later, I changed it, and I feel, it's not gone completely, but it definitely feels better. So I think some of those more obvious things that you don't think about, but when you do think about it, it's like, oh, maybe it's time to go do that.
Okay, so what's the deal with posture? People sometimes when I say that, they're like, yeah, yeah. Why is posture a big deal? You got to work, you got to sit, you got to type on the computer. Why should we really care about? Yeah, we know it, but how? Let's talk the how. Like, why is that a big deal for someone who's like, well, that's my livelihood.
Right. So I think and let me, if I can maybe, I'm going to adjust. So like if you're sitting in a chair, a lot of times we sort of sit like this, where you're kind of hunched forward, your shoulders are forward, and that curved position is not our natural position. It's putting curves in our spine that are not naturally there, and it's putting more pressure on your low back area than is necessary. So when you're kind of sitting hunched like this for hours and
Mm,
hours, you're putting undue pressure on areas that are not meant to have that. And so, kind of the idea would be, you pull your shoulder blades back and down, and you kind of get your spine a little more upright. And the way I always try to think about it is almost like you have a string on your head that's attached to the ceiling that's like pulling you upright. It helps keep your center of gravity where it should be, and will help relieve some of that undue pressure on your low back area
mm,
when you're sitting. And the other thing is things depending on your job and stuff. If you can take breaks where you do stand up from time to time or do some stretches, that can be really helpful so that you're not in that same position, for hours and hours.
Oh, awesome, awesome. Now let's talk about the ones who, on the bed typing. Um,
Yeah.
I actually had a patient who actually had really bad cervical, so the neck bone pinching from doing that for years. So people say, well, I'm tired of sitting, so I go like this. What's wrong with this stuff?
Yeah, I mean, I think again, your body's not, it's similarly to being crunched over, your
Mm,
body's not built to stay in this position for a long time. And you're crunching nerves that, are in your neck. And then there's extensions that sort of come out and down this way. So if you're sitting like this for a long time, you're really crunching those nerves in a way that they don't like. And then chronically over time, they can start to get damaged because of that. And so, to relieve that pressure, again, you need to work on your flexibility and adjusting your positioning so that it's more ergonomic.
more ergonomic. Beautiful. Now let's talk simple stretching exercises. And I love that you're already doing the show and tell. So for someone who's watching who's like, wait, I can't leave my job. I work from home. I like it. I sit most of the time. What are simple stretching exercises I could do while at work? What would you say
Yeah.
now?
So neck exercises are very straightforward to do even while you're sitting at your desk. You don't even have to get up. So for me, you can probably see me, and you can do this sitting or standing, but just really simple, gentle is range of motion stretches for your neck. So I always start with just looking down to the floor and bringing my chin to my chest. And when I stretch, I will typically, depending on the area and what I'm stretching and where I'm having pain, I'll hold it for maybe 30 seconds, maybe a minute. If stuff is feeling a little spicy, and what I mean by that is like when you do it, it's like, ooh, like it's not pain. Because if you ever have pain, you want to stop, but you're definitely stretching into discomfort. That can just be a sign that you're in the right place and you just need to sit there. And a lot of times if you sit there, you'll eventually over, a minute or two start to feel some relief. So I always start with head, chin down, then gently I lift up and look at the ceiling. And again, it's super gentle. You don't want to force anything. Discomfort when you're stretching is okay. Pain is not. And then, once I hold that and things are feeling, loose there, then I do a little rotation to the side. And same idea here, you're kind of bringing your chin to that shoulder. Whatever way you're turning, you're bringing your chin towards that shoulder, holding it, and then same thing, other direction. This one, I use a little bit of a gentle hand. So I bring my ear to my shoulder and kind of just gently press. Now this one, you can take I may be a little out of frame, but you can take that other hand and point it down, almost like you're reaching down to pick up a suitcase. And that can just give you a little added stretch there. And then gently up, and then same thing, the other side. So that's, those are kind of just the simple range of motion. Once you kind of have that down and you're feeling good about that, you can always add in some neck circles where you kind of take your head in a gentle circle. But I would recommend starting just with those basic ones until you feel your neck starting to loosen up and you get comfortable with it. And then, you can go into those circles.
All right, awesome. I have someone who's like, oh man, this is going to take time off my, I have work, I have deadlines, I have things to do. How long do these things last? For someone who's wondering like, oh, you're going to make me waste time at work, or I don't have time for that.
I mean, like I said, I would say if you are not stretching currently, I mean, even if you can do 15 to 30 seconds of each of those. So let's see, 1, 2, 3, 4, 5, 6. So, I mean, if you did 30 seconds, that's 3 minutes. I mean, that's up and back to the bathroom, right? So it's not anything wild. And then if you can't, like I said, sometimes you may get into a situation where it's like, ooh, I need to hold that one longer. You can always do it multiple times a day. You can do it in the morning. You can take your 3-minute break. You could do it later in the afternoon. It doesn't have to be, like a 10, 15-minute situation.
Okay. I like that. 3 minutes, even less. Actually, it's so
if
it's
you
doable.
did 15, right.
Yeah, it's doable. And you can put a little reminder stretch in your day. So you do it. And remember, we're having this discussion to minimize risk of pain and damage to your spine, because the pain precedes the damage. So it comes before the damage. And it's not just, okay, of course, we want you to be pain-free, but also it actually makes you a better worker and you enjoy a better quality of life. Now, for someone, so someone asked, what should you do if you start to feel dizzy? Good question when you're doing the stretches.
Yeah, so definitely if you feel dizzy, you definitely want to stop, take a rest, sit down. Obviously, if it goes away, it may have just been that you were in a position that your body is not used to, and as you practice, it will go away. But if you are dizzy and it's not going away, that is, that's an emergency type of sign. You want to definitely call your doctor and all of that. It's also important to pay attention to your hydration status, because if you're not drinking enough water and you're changing positions, that can sometimes trigger you to feel a little bit dizzy. But definitely don't take those type of symptoms lightly. If you're, like I said, discomfort is okay. Pain, dizziness, anything like that, you want to stop and evaluate what's going on with your body.
Very important. Of course, we know that these are medical suggestions. Important to see your doctor to come up with a plan customized for you.
Yeah.
Now, for someone who's most of the time long hours sitting, yes, we know the stretching breaks. Are there other specific stretches that are particularly effective for those kind of people who sit long time?
Yeah. So I think low back and hip stretches can be really helpful for people sitting. And I'm going to just adjust here so I can show a couple. So this one is, you kind of have to be able to maneuver onto the floor, and I can show some modifications. But this is one of my absolute favorite stretches for low back pain for people sitting. It really helps release your low back. If anybody's ever done yoga, it's called child's pose, which is something that is just like very calming. And even when I'm not stretching, but I feel stressed out, I do
Mm,
it and it helps me. So basically, you put your big toes together and you have your knees a little more than shoulder width apart. And then you just drop your bottom down and you let your arms fall forward. And the other thing with stretching is, like, if you're watching somebody else do it and you're like, oh, absolutely not, like, there's no way I can do that. It's okay. Just start somewhere and try, because as
mm,
your body becomes more flexible, it will become easier for you. And this happened to me when I recently started doing some new stretches. I was like, oh my gosh, I cannot do what that instructor is doing. And after a few weeks, it was like, oh, I'm getting closer to it. Like, you just have to practice. So this one, again, I just have to get my head down there. And this one, it can be anywhere from, 15 seconds if it's something that's like, oh boy, I need to get used to this, versus, you get to where you're doing it for 2 or 3 minutes to help release your back. Another one, which there's kind of two modifications. This is another yoga one, but also a really good back stretch, is cat cow. So if you're comfortable getting onto your hands and knees, you can do it on your hands and knees like this, where basically you go into a cow position, which is where you sort of arch your back and
mm.
point your head towards the ceiling. And then the cat part is, if you think about a cat that looks scared, they sort of arch their back the other way. And for this one, it really helps if you tuck your bottom like underneath. So you're sort of tilting your hips under this way. And then you can just kind of gently, this one you don't necessarily have to hold, you can just kind of go back and forth. And I hold wherever I feel that, like, ooh, okay, this is a little tight, that's when I'll hold it. A modification for that, if you have trouble getting onto your knees or you have
Mm,
knee
mm,
issues, you can also do that when sitting. So same idea. And you could even do this, with your knee, like sitting in a chair if you can't get
okay.
onto the floor. But same idea, you kind of, arch your back, pull your shoulders back, head toward the ceiling. And then the cat part is you curve down. And then you just kind of flow through that. And again, with practice, you can start to feel the spots that get sticky and where you need to sit. And the last one for people sitting is really to target your hip flexors. So your hip flexors are these muscles in here that are at the front of
Mhm.
your hips. So when you're sitting all day like this, those muscles are kind of crunched up, and we very rarely stretch them out. And that's where a lot of times that can actually be the contributing factor for back pain. And so stretching those out can be really helpful. So this one, again, you do have to kind of get on your knees, but you can get one knee up into 90 degrees, and then you just tuck your pelvis under. And when you do this, you'll feel a stretch
Mm.
down the front of this hip that will really help release that. And then again, obviously, you have two legs, you got to switch and do the other side, but same idea. So you get that 90-degree leg position and tuck your hip under. And you can, again, if you have like knee pain issues, you can always put a pillow or a towel under that knee that's on the floor. And for somebody that, I know a question that might come up is like, I'm at work, I can't get up and do that type
Right,
of thing.
right.
Yeah, that's so you can just sit in your chair. Now, I don't have a chair here, but I'll just pretend. You can, pick one leg up and put it over with the other knee down and just kind of press down on that top knee. That will also help stretch out the hip flexor, but also your glute muscle that kind of wraps around that side. And of course, you want to do both sides. So you're sitting, you do this one, and then you put that other leg down, and then you get the other one across like that. And again, you kind of press down.
So seated, standing on the mat, there are options. And these are things you could weave into the day while at work. Work. Awesome, awesome. Thank you, Doc. That was very good. And I like the show and tell. I really appreciate you doing that.
Absolutely.
Now,
that's why I'm here.
Can we talk about some of the common misconception is the word, but are there some common hiccups that you see, patients have about stretching, their fears? And I want us to discuss them for someone who is like, yeah, good for you. It looks like you've been doing this for 10 years, so you can do it. But what are some of the common hiccups that patients or people have when it comes to stretching, and how do we debunk them? Maybe 2 or 3 of them.
Yeah, so I think fear is the biggest one. And one thing that I found to be really effective was showing patients in the office the stretches and having them do it with me in the office, because I think that helps alleviate some of that fear, because the first time they do it, you're with them. And so you can sort of help guide them to like, okay, ouch, this really, really hurts. Stop, not okay. Or this is discomfort, but it's okay. It's okay to sit in the discomfort. And like I said before, after a minute or two, like that will start to relieve as the tension is releasing from that muscle. So I think fear is a big one. I think another one, like we kind of already talked about, is I have to dedicate many minutes to this and I don't have time. And it truly does not have to be. I mean, there are days where I can't figure out the timing and I stretch for 1 minute. And it makes a difference. Like it makes a difference compared to stretching 0 minutes. Because if you target the areas that your body needs, that minute can really help. And, when you start to think about it, it's like, okay, I could probably find a minute a couple times a day, so you can fit it in throughout the day. And then I think the last thing is that you have to be an everyday exerciser or an athlete or, some crazy exercise person to be able to stretch. You absolutely do not. I mean, you can be doing not a lot of activity at all. Stretching is still hugely important because the mobility and flexibility in your muscles will allow you to stay mobile as you age. Because if you'll notice, like the more you sit, the stiffer you feel. So it's movement is important, but stretching, especially because it helps lengthen those muscles out, that is important. So I think, that's another thing for patients to think about.
Thank you. Now I have a very good question here. Someone asked, hi, Tanika, thank you for stopping by. It says, how long should you hold the stretch when seated?
Yeah, so I think that, it depends on you and your body. I always recommend starting with 15 to 30 seconds, but a lot of times you'll notice as you start to do this, you'll find that maybe there are certain ones you want to hold for a minute or 2 minutes. I think 30 seconds is a good middle of the road place to start, because it doesn't mean you're needing to have 10 minutes of time, but it's enough time to let your muscle be able to lengthen and relax. And then as you adjust to it, you can build up to, longer holds with each stretch.
Okay. Awesome. This has been very good. We're about to wrap up. I have one more question before I ask where people can find you. For someone who's watching, who's like, oh, I've had, I don't know if I'm a stretcher or, I'm used to sitting down for a long period of time. And maybe this sounds like more work to them. Any words of encouragement, Doc, to get people moving, stretching a little bit more so that they preserve their limbs?
Yeah. So I think it's all about connecting with your why, right? So, everybody wants to age without pain and being able to move the way that they move now. And so, and you got to sit down and figure out what it is for you, that like, why do you want to be able to do that? Do you have grandkids that you want to be able to help take care of and jump around with? Do you want to be able to be active with your spouse or a friend and travel? If you can't move, or if you have a lot of pain when you move, that's going to be a major limiting factor. And so I think keeping those motivating factors for you at the forefront of your mind can really help. And it is one of those things that's a habit. Once you get into it and you've done it for a few days, you'll start to see benefits. And then you're like, oh, I want to keep doing this. Like, what could happen if I keep doing this? Because this is awesome.
I agree. That has been very, very good. And so, Doc, my final question to you is, for someone who's watching, who's like, I like that you're very passionate about exercise. I like that you help people, with stretching and other things that you do as a family physician too. Where can people connect with you, Doc?
Sure. So I have a website where you can sign up for my free newsletter, which is kind of all about this sort of stuff. So it's Dr. and then my name, Sara, Sara, Ionescu, IONESCU.com. And then I post on YouTube, Instagram, and Facebook. And I'm Dr. Sara Ionescu at all of those places. So just at Dr. Sara Ionescu.
Awesome. And I'm posting that in the comments so people know where to connect with you at the bottom of the screen. She's also all over social media. She's on Instagram, YouTube, Facebook, and LinkedIn. Just type in her name, and you'll find her. Thank you so much for coming, Doc. I really appreciate you taking the time to hang out with us and for the show and tell. I'm not going to forget that. I appreciate you.
Thank you. Thank you so much for having me. It was wonderful to be here.
All right. Awesome. Thank you all for watching live and replay. As always, I say this every live show, caring is sharing. So please forward this to those who could find this useful. And as always, if you have any topics you want us to discuss, you can send me a message, leave a comment, even right here on Facebook or YouTube, and we'll have someone come. We can have Dr. Ionescu come back again and talk about something that relates to stretching of the parts, and maybe a rerun or repeat of this. Okay. And as always, before I wrap up, if you or anyone you know is looking for an awesome, a thorough, a compassionate family physician who will help you live long and well, I am she. Have a good one, everyone, and stay well stretched. Okay. All right. Thank you, everyone. Bye.
Bye.